I'm Dr. Lisa Barker. I'm a general pediatrician and I've been practicing for about 6 years. And I bet you have a lot of questions about HPV virus and especially the hype around the HPV vaccine. And I'm here to help provide answers to your questions and additional information. HPV stands for human papillomavirus, which is actually a family of over 150 different types of viruses, all of which cause infection either on skin surfaces or mucosal membranes, parts of the body like the vaginal area, around the anus, and in the throat and bronchial cavities. These infections are often cleared naturally by the body, but when they're not, they set up sort of a persistent infection, and it can result in cell changes that can lead to cancer or warts.
It is much like a cold virus in terms of the fact that it spreads so easily. Almost everybody will get exposed and have effect from it. There's currently 79 million people in the United States with HPV disease, and there's 1.4 million new cases per year.
Most people who have it don't know that they have it. So the best thing you can do is to protect yourself before you're exposed. This can prevent cancer, this can prevent genital warts, and it can make a huge difference for your future. This vaccine has been studied now for approximately 15 years and has shown excellent safety data, and that none of the severe side effects or reactions that have been reported have actually been linked to HPV vaccination.
So for parents that are concerned about this vaccine specifically, I'd point out that vaccines are rigorously studied for both their effectiveness and for safety. There's a lot of negative press about vaccines, and there's a big anti-vaccine culture that is present, and you can't really avoid it in your daily life.
I do just really encourage making sure that you're looking at credible sources, and bottom line is if you have any questions or concerns, please talk to your medical provider.
Parents often worry that giving this vaccine gives the message that it's okay to have sex, and I think it's important to remember that the data shows that this is not the case.
These studies have actually looked at this, and there is absolutely no link between HPV vaccine and an increased rate of sexual activity or an earlier age of sexual debut.
So if you think about how important this vaccine is, really it comes down to who doesn't get touched by cancer, and wouldn't you want to protect yourself against cancer and your child?
This can obviously make a huge difference for your daughter's future. I like to think about young women and their experiences as they move into adulthood and having their yearly pap smears, and all of the women that I know and that you probably know who have experienced cervical changes and abnormal pap smears, and realizing that this vaccine can prevent that for your child, I think is incredible.
So as time has gone on, we've understood the crucial fact that boys need to get the vaccine too. Coverage by just immunizing girls was not sufficient to get the rate of coverage in the United States up to a level that we expected to make a large impact on the rates of cervical cancer. And so we started doing boys, realizing that they are also impacted by HPV-related cancers.
HPV vaccination is currently recommended for all boys starting at age 11 to 12, and this is for several reasons. First, HPV vaccination prevents cancers in men and women. In men, these are specifically related to the penis, the anus, and the throat cavity. And in fact, oral cancers are on the rise with increasing cases every year. And we see about 9,000 new HPV-related cancer cases affecting men each year.
So many parents wonder why we give the vaccine so young, and really it comes down to the response that we get. Like in a baseball game, if we get a home run, it's a better outcome than if we get a single. And with the HPV vaccine, when we give it at 11 to 13, it's really a home run for our kids. If we give it later in life, 16, 21, later on, you only get a single, and so you get less coverage, and so your protection against these cancer-causing viruses is less.
And if we can take this opportunity now when kids are young and they have not been exposed to this virus to set up a protection and to prevent cancer, I think that's an incredible opportunity.
Get the kids vaccinated, protect them long term. If we do it now, we can protect them throughout their life. If we wait until they're older to have that discussion, if we think they're too young to have it now, we've missed the boat and we're not going to protect them.